Hi guys, welcome to Tenancy Health Talk. This platform is there to educate you about your health, your well-being, and how to prevent diseases. Prevention is less expensive than cure, and prevention is better than cure. It is better that you prevent or disease from happening than for you to be infected with the disease before going to the hospital. So keep following this channel and know some health tips that will help you prevent diseases, that you'll be safe and have a healthier life. Health is wealth. So keep focusing on Tenancy channel and prevent diseases. So our today's topic is cervical cancer. The other time we discussed about human papilloma virus, and then we said that the HPV, which is the human papilloma virus, is one of the causes that cause cervical cancer. So cervical cancer is a growth of cells that starts in the cervix. The cervix, when you talk about cervix, is the lower part of the uterus that connects to the female private part. So that opening in the female private part, there where the cervical cancer can start from. That opening. So female are mostly affected with this disease, or men can have a HPV, but then they cannot have or they cannot be infected with cervical cancer. So women are mostly at risk of getting this particular disease. So various strains of the human papilloma virus, also called HPV, play a role in causing most cervical cancers. So HPV is a common infection that passes through sexual contact. When exposed to HPV, the body immune system typically prevent the virus from doing harm. So if you have a HPV virus, it's possible that you be infected with or cervical cancer, mostly women. So women are mostly at risk of getting cervical cancer. So you can reduce the risk of developing cervical cancer by having screening tests and receiving a vaccine that protects against HPV infection. So you can also prevent this particular cervical cancer. If you have a girl child that is 9 years old who have not have sexual contact with anyone, you can take them at the hospital to take the HPV vaccine. Better still, you yourself do your screening, your cervical cancer screening. Like last year, 2024, we visited some hospitals and communities where we were able to do some HPV, not HPV, but cervical cancer screening for women. So cervical cancer is a very STIs that actually affect we women. So if you have a HPV virus, how do you know that you have a HPV virus? So when it starts, cervical cancer might not cause or symptoms, right? So if you have a cervical cancer, at the first stage, you won't notice any sound that you have or cervical cancer. But as it grows, cervical cancer might cause signs and symptoms such as your private part bleeding after intercourse. After making love, you'll notice that you bleed heavily. These are signs that you'll notice as a female that you you are infected. After making love with your partners, you experience bleeding between periods or after menopause, during your menopause time. So there are some ladies in your 65, 50, 65. You are already in your menopause stage, but then you are still experiencing bleeding. These are all signs of cervical cancer. So menstrual bleeding that is heavier and lasts longer than usual. So normally our menstrual periods also spend 7 days, maximum 5 days. But then if it exceeds, some people 5 days, some people 6 days or 7 days. So if it exceeds to the usual stage and then you keep experiencing bleeding, these are all signs of cervical cancer. Watch your bloody private part discharge. As a female, you're experiencing heavy discharge, bleeding from your private part. These are all signs of cervical cancer. So pelvic pain and pain during intercourse, like I said, pain during intercourse, you feel severe pain whenever you are making love with your partners. These are all signs of cervical cancer. And cervical cancer begins when our healthier cells in the surface develop changes. So these are signs of cervical cancers that you need to focus on. So if you have these signs as a female, whenever you are having intercourse, you feel pain, you experience heavy bleeding, it's very important that you go to the hospital or seek advice from your doctors or from a health practitioner. Do not just be silent. Speak up. Know about your body. When you're noticing any signs that 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 is abnormal, it's very important that you go at the hospital. So most cervical cancer are caused by HPV. This particular disease, most of the cervical cancer are caused by the human papilloma virus, and HPV is a common virus that passes through sexual contact, like I said. So there are types of cervical cancer. So cervical cancer is divided into 2 types based on the type of cell in which the cancer begins. So one of the main types of cervical cancer are the squamous cell carcinoma. This type of cervical cancer begins in thin, flat cells called squamous cell. The squamous cells line the outer part of the cervix. So the squamous is at the opening of the female private part. So these are cervical cancer. So most cervical cancer are squamous cells, the opening of the female private part. And another sometimes both types of cervical cancer are involved in very rare, and cervical cancer occur in other cells in the cervix. The cervical cancer, most of them, it occur in the cervix, the female cervix, that the opening parts of the female private part. So there are people who are at risk for cervical cancer. So there are factors. Cervical cancer include people who are at risk. Who are those who are at risk? We say smoking, tobacco. So smoking increases the risk of cervical cancer. So if you somebody that can smoke, or female who can smoke, because we are the one that are mostly affected with this virus. If you can smoke, you are also at risk of getting this particular disease called HPV and cervical cancer. If you are not HPV but cervical cancer, you are also at risk of getting cervical cancer. So when HPV infections happen in people who smoke, the infection tends to last longer and less likely to go away. So HPV can causes most cervical cancers. So if the HPV virus is already in a female or male, for male they don't have cervical cancer, but for female, and then that female can smoke or that lady can smoke, it increase the risk of that cervical cancer going away. It will spend a lot of time before that cervical cancer go away. So people who are also at risk are people who are polygamous, increasing number of sexual partners. So the greater your number of sexual partners and the greater your partner number of sexual partners, the greater your chance of getting HPV. So the HPV virus you can get it through sexual contact, right? So if you have a partner who have a number of partners, you are also at risk of getting HPV and also cervical cancer. So another people that are at risk is people who start having sexual contact early sexual activities. For a girl child or a boy or a girl who just start having sexual intercourse or sexual activity, there is a possibility that you have or cervical cancer and many STI, sexual transmitted infections, because at that time your body has not fully developed, and then you don't know the risk factors that come with making love with a person. And you are also at risk of many diseases, the HIV, chlamydia, gonorrhea, syphilis, and HPV virus. So people who are at risk, if people who just start having sex early, the teenagers, the younger one, the young people, mostly the teenagers, you are also at risk of having cervical cancer. Another people who are at risk is people who have weakened immune system. If your immune system is very, very weak, you may be more likely to develop cervical cancer. If your immune system is weakened by another health condition and you have HPV. So if you have another health condition and that weaken your immune system, you are also at risk of getting cervical cancer. This disease is actually a very bad disease that affects female, and women, girls. It affects us mostly. So we need to pay serious attention to this particular disease. So how can we prevent cervical cancer? To reduce your risk of cervical cancer, ask your doctor about the HPV vaccine. So receiving a vaccination to prevent HPV infection may reduce your risk of cervical cancer and other HPV-related cancer. So ask your healthcare team if an HPV is right for you. So you need to ask a health team or go to the hospital and ask whether you can take the HPV vaccine. So for the HPV vaccine is actually for a girl child who have not had sexual activity with anyone. They're 9 years old. If you have a girl child who is 9 years old, take them to the clinic to take the HPV vaccine. The reason they are taking the HPV vaccine is for them to prevent nearby disease like the cervical cancer, to prevent cervical cancer in the future. Because if you take the vaccine, vaccine is one of the effective preventive measure that we can take. If you take a vaccine of a particular disease, you cannot get contaminated or infected with that particular disease. So if you have a 9-year-old child who have not had any sexual activity or sexual intercourse, take them to the hospital to take the HPV vaccine, the human papilloma virus. Go to the hospital, take your girl child there to take the vaccine. The nearby clinic, just go there and ask the health workers whether they have or HPV vaccine that your child will be able to take the HPV vaccine. So another way, if you are already past the stage of taking the HPV vaccine, for the female, do your cervical cancer screening. They have this machine that can do the cervical cancer screening. So go to the hospital, tell them that you want to do a screening. Do your screening. Another way to prevent cervical cancer is to practice safe sex. Reduce your risk of cervical cancer by taking measures to prevent sexual transmitted infection. So this may include using a condom every time you are making love with your partners. So make sure that you use condom whenever you are making love with your partner. This will also help to prevent cervical cancer and other sexual transmitted infections like gonorrhea, syphilis. It will also help, and even HIV. It will also help to prevent these sexual transmitted infections. So every time that you are having sexual activities or making love with your partners, and then you notice that your partners, he or she is not faithful, make sure that you use condom to prevent these diseases. So don't smoke. If you don't smoke, it's very, very good for you, and this will also prevent you to not really have have HPV or cervical cancer. Because like I said, HPV, you can also get HPV. Those who are smoking, they are also at risk, right? So if you reduce smoking, or if you stop smoking, you are not at risk of getting HPV or cervical cancer. Because if you start smoking, if you be infected with that disease, it will spend longer time to get killed. Because if you just have or HPV virus, sometimes it can go away, right? If you take medication, if you just start the infection sooner, if the infection is just starting early, it can be killed then when you spend longer time. So smoking can increase the time spent of HPV within you. So it's very important that you limit smoking or don't smoke at all. So for more videos, please follow this channel to know more about your health, to prevent diseases, to prevent STI, and many other health programs that will be coming out. So we do one-on-one health education, group education to young people to help them to prevent diseases. Prevention is actually less expensive than cure. So keep following Tinisi channel to know more about your health. Health is wealth. So keep following and prevent HPV virus, prevent cervical cancer. More especially ladies, prevent cervical cancer. If you're noticing any of these signs, like heavy bleeding, during intercourse or after intercourse, feeling pain in your pelvic, go to the hospital and do your test. Do not just keep quiet. Know your body. Be sensitive to your body. If you are noticing heavy bleeding during your menstrual period, go to the hospital and ask the doctor what is happening to your body, to know more about your body and your health. So for more video, please subscribe to my YouTube channel, share, comment, and keep following this channel. Bye bye.